Message we've been delivering, and I've been really encouraged. People have been stepping up, joining our charge. I'm a first-time candidate. We've received the public support of about every statewide office holder here in Indiana. The majority of our Republican county chairmen supported our campaign. We've broken fundraising records by several orders of magnitude, which is important if you're trying to get your message out in this district. We're doing all the things we need to do. And it's my hope that coming out of here tonight, some of you will decide to get actively involved in our campaign. Because we have an incredible opportunity here in Indiana's 9th District to do our part. It only takes a handful of seats to change the complexion of the U.S. House of Representatives. This is one of the most competitive seats in the nation. We know that. And if there are candidates in 15 or 20 of the most competitive districts of the country holding forums like this, and caring Americans like yourself attending these forums, we can really change this country for the better. So tonight, we're going to fill in some of the blanks. We're going to talk specific issues. I'm going to hear what's on your mind. And it's my hope that you'll join our charge when you leave here tonight and decide to become part of this effort, which will conclude our primary portion on May 4th. And then in November, we can do some really exciting things. So thank you very much. I'll take our first question. Yes, sir.
I think it would speak volumes if you would clarify whose town hall meeting it is tonight.
All right. This is your town hall meeting, and you make the rules. So though I've decided to only give a speech for a portion of time and ask questions, if you all decide you want to just hear me ramble on for 2 straight hours, I can do that too. Yes, sir.
What little I know about the health care bill, I'm very disappointed. I have a chance of losing some of my health insurance the way things are going. I would be wondering what your opinion is of what you know about it so far.
Sure. Question is about the health care legislation and my opinion of it. And the gentleman accurately said, he added what you know about, asked me what I know about the legislation so far and my opinion of that. And I think it is fair to qualify that because we're still discovering exactly what's in there and the implications of that. And much of the health care legislation, its impact will depend on how the Health and Human Services, Department of Health and Human Services actually interprets it. And they go back and they start developing regulations based on that law. And so we're not quite sure what the implications will be of it, but everything I have seen suggests that this is actually going to increase the cost of health care in this country, which is incredibly ironic because we embarked down this course of health care reform, or remember during the presidential debates and campaign, to try and bring down the cost of health insurance. That was the entire objective. Bring down the cost of health insurance so that working families and individuals could afford health insurance. And if instead we're bending the cost curve upward, then to me that's really trouble. Now, it appears as though Congress has engaged in certain accounting gimmicks, like they have a habit of doing, to make that legislation look more fiscally responsible. They start taxing us now for plans that will kick in later, for example. Here's my thought. We're turning a lot of our personal decisions over to government. We are giving up some of our most fundamental life decision sort of powers and responsibilities to government bodies. They're starting to mandate what sort of insurance policies are out there in a very specific way. All of those things trouble me. It was my hope that when we began this health care reform debate, we would have included some really commonsensical proposals, put those on the table and talked about those, Republican and Democrat, both discussing the merits and demerits of things like allowing people to purchase health insurance across state lines. I call it value shopping for health insurance. Now this district goes from Bloomington and Columbus all the way down to the Ohio River counties. I can literally stand in Madison, Indiana, or in Jeffersonville, Indiana, look out across that Ohio River, and it just seems odd to me that we freedom-loving Americans are prohibited from buying health insurance across that river. That's called economic liberty, economic freedom. It's the reason we have a constitution in many respects. We'll recall that when before the Constitution, we had the Articles of Confederation, and each individual state set up tariff barriers. They set up barriers to trade between the different states. And so our framers got together, the framers of our Constitution, they said, let's break down these barriers and let's put interstate commerce in control. Let's put Congress in control of interstate commerce. They can regulate that. And the whole idea was to prevent states from erecting those barriers. So let's tear those barriers down and allow people to value shop for health insurance. There's no reason a Hoosier shouldn't be able to buy a health care policy out of Kentucky or Hawaii or Delaware. Let's take care of the pre-existing condition problem. I happen to be very sympathetic to those people who lose their health insurance because they happen to have lost a job, or God forbid they get divorced. Then they contract some horrible condition, they go back and try and buy health insurance, and they can't afford it. You know, I think that is a sad situation, so how do we address that? There's actually a market solution to that. It's called health status insurance. Is anyone familiar with it? It's because no one's talking about it, unfortunately. But what health status insurance would allow people like Tony there in the yellow shirt in the back to say, okay, I'm going to buy health insurance. I also want to purchase a little strip of insurance on top of that. That little strip of insurance would ensure that if I ever lose this insurance plan, I can go back into the marketplace and be guaranteed that I'm not going to be paying any more for my premium than I did before. That's health status insurance. Right now there are regulatory barriers to it. But if Congress would try and remove those regulatory barriers, then we take care of the pre-existing condition problem without mandating that insurance companies have to cover different people. So that's another piece of the equation. There are all sorts of these things that could be embraced but aren't being embraced. Let me talk about one more. Some of you may know that I went to law school. I'm a licensed attorney. There is a very real phenomenon out there of attorneys looking for jackpot lawsuits, and that increases the cost of medical malpractice insurance, which is one of the reasons we have health insurance inflation. So we ought to address that problem by going through some sort of tort reform. Now, we can have an argument as to whether that should occur at the state level or the federal level. But again, this is one of the things that was completely taken off the table in Congress, and to me that's very disappointing. So, I guess the bottom line, sir, I don't want to nibble around the edges here. I think we need to scrap the current plan unless we somehow discover after further study that this is just an incredible solution to all our healthcare needs, and I don't think we'll discover that. I think the news is only going to get worse. But scrap this plan and start over.
You're right.
And I'll be part of that solution.
Well, I'm retired, and my insurance is funded by my company. I'm retired from. And if I understand it correctly, with this health care bill, they can drop my insurance and pay a fine. It'd be a lot less money for them than paying my insurance.
You know,
That kind of thing really disturbs me.
that is the analysis of, say, the Heritage Foundation. I used to work at the Heritage Foundation for this public policy think tank. And that's the argument they make, sir, which is that it's more economical for many of these employers just to drop your insurance and then pay the fine. Was this really what Congress intended when they embarked on health care reform? Gosh, I hope not.
First of all, I want to thank you for having this meeting, but it's doing a lot of good to meet you and hear your views. I'm getting tired of not voting for a person, but voting against somebody. And that's been, we've not had a lot of choices. And I am in a little different situation than Ed. I am entirely on Medicare. And I'm very sorry to say that there wasn't one of our representatives in either sides of the Congress that was a standard bearer for senior citizens.